So in the next 5 minutes, you are going to understand the differences between an X-ray, CT scan, MRI and an ultrasound, and when each one of them is used. So if you go to a doctor, the primary line of investigation that a doctor would generally order is an X-ray or an ultrasound. But in this video, we are also going to understand a little bit about CT scan and an MRI. So when we talk about X-rays, this is nothing but a radiation-based device wherein radiation is thrown onto your body and your body is then exposed to this radiation, and behind your body part is kept the radiographic plate. Now what happens is the organs or tissues of your body that do not allow the radiation to pass through them appear as bright white color on an X-ray, whereas organs or tissues that allow partially or completely through it appear as light grey or dark black shadows. Now, just understanding this concept, you can analyze when an X-ray is used. X-rays are generally used for bones because bones do not allow the X-rays or the radiation to pass through them, and hence it appears at white color, and we can detect the bone fractures, hairline fractures. We can also detect misalignments, dislocations, or we can also impactfully understand if there is a reduction in the joint space, meaning two bones at a joint have come close to each other. Normally people confuse that cartilages can also be seen on an X-ray, but that's not true. What a doctor is generally analyzing is that the joint space is reduced, meaning the cartilage is already damaged, but there is no clear-cut evidence of cartilage damage on an X-ray. There can only be a partial assessment of cartilage, but full assessment is not possible. Second place where X-rays are used is in lung shadows. So chest X-ray is normally ordered because in the lung there are a lot of things that are translucent or radiolucent, we should say, meaning they allow X-rays to pass through them partially. When that happens, what happens is few things appear as dark grey or light grey on a X-ray, which can help in diagnosis, like what happens in sarcoidosis, what happens in tuberculosis. There are hilar shadows, there are bronchiovascular markings that are seen differently on an X-ray. So hence there is some establishment of lung diseases which can happen through an X-ray. Again, the concept is that if a part of your lung appears as light grey, then we know that there is some abnormality we can detect on it. But if it appears completely dark black, then there is another problem. That means X-rays are completely passing through it, which means lungs are contracted, which happens in pneumothorax, or when air is filled in the cavities of the lung, pleura of the lung. Now there are other places where there can be fluid accumulation in the chest, which happens in heart diseases, which can also be detected in pleura, in pericardium. There can be fluid accumulation which can also be seen sometimes on an X-ray, and hence X-rays are good for lungs also. The third place we generally use X-rays are for stones, because stones, again, there are some radio transparent stones and there are radio opaque stones. So radio opaque stones, basically the calcium stones, generally appear white in the X-rays, and hence X-ray kidney, ureter, bladder is generally ordered to check if there are any stones in the kidneys, ureters or the urinary bladder, and hence radio opaque or stones which does not allow X-ray to pass through them can be easily seen on an X-ray, and hence it can be used in establishing stones. But generally for stone, kidney stones or liver stones, we generally use an ultrasound, which is better, which we'll discuss in the coming few minutes. Now the second is a CT scan. CT scan, if you want to understand, it's an extension of an X-ray. It's a modified version, or I should say an advanced version of an X-ray, because it also uses a radiation. X-ray machines basically have a 2D imagery, whereas CT scan is 360 degrees. If you've seen, it's a ring which throws the X-ray. So you take the X-ray view 360 degrees, and it's basically radiation passed through those circular 360 degree angle. It provides better images, 3D graphical representation of the organ involved, which we have to check, that is available, and the contrast is very high. Again, CT scan is also used for similar purposes, for seeing the bones, and generally it's used in chest X-ray. Like in COVID, CT scan was ordered in few patients. The reason was you could see some high resolution contrast CT was ordered because you could see they would illuminate some shadows on the lung which were identified with COVID severity or lung damage in COVID. So hence lungs can be seen, and again obviously for stones generally CT scan is not ordered, but CT scan is also ordered for abdominal problems. But basic concept is wherever you have radio opacity, means any part of your body which does not allow radiation to pass through it or it absorbs the radiation, will appear better on a CT scan on an X-ray, and hence that is where CT scan is ordered. So for bones and for lung shadows, CT scan is pretty good. In fact, even for head, normally CT scan is ordered because it sees the skull, the bone. If there is a head injury, CT scan tells us that blood accumulation, subarachnoid hemorrhages is a term which is used. So it can detect a lot of things in the CT scan also. But if you actually want to see the inside of the brain, CT scan is not good. Why? Because the radiations generally pass through brain, so you cannot see the brain tissue or identify different parts of a brain on a CT scan. You can identify the bone, some blood accumulation and everything can be identified on a CT scan, but not the brain. For brain, we need an MRI. I'll come to the point where we talk about MRI. So this is where we use a CT scan. Now there is something called as resolution CT scan or contrast based CT scan, wherein what happens is, what we use is, or CT angiogram you might have heard of, in which the blood vessels of the heart, blood vessels supplying blood to the heart are detected. So how does that happen? So what happens is, a radio opaque dye, a radio opaque chemical is injected in your blood, means it absorbs the radiation, and then your heart is viewed through it. So what happens is, all the blood vessels that are supplying blood to the heart get illuminated bright white. And what happens is, if there is a constriction within those blood vessels or there is obstruction due to some deposition or constriction, it immediately gets identified. Why? Because this radio opaque dye would be flowing through that blood vessels, and at the point where there is obstruction, there will be narrowing. So the bright white light is going and it will narrow down immediately if it touches or a point where there is obstruction, and beyond that you will see less dye going, means less white shadow, and hence this is good for a CT angiogram also, wherein you inject a radio opaque dye into the patient. So this is about the CT scan. Obviously in COVID we also had non-contrast CT scan and a high resolution contrast CT scan, wherein a dye was injected which again illuminated the lungs pretty well so that the lung fields could be viewed better. Now the third is an MRI. So MRI is absolutely different from an X-ray and CT scan because it does not use radiation. It works on magnetic field. So it works on the prima facie that protons are available in your body in each and every cell, each and every organ, and water is available completely throughout your body. So what happens is, when you run through that magnetic field within that chamber of an MRI, a magnetic field, magnetism is created by different tissues of your body. This magnetism is different in every tissue of your body because the water content of every tissue is different. So there is difference of protons, number of protons which are available, and hence it can differentiate based on different magnetic image of each and every organ of your body. So by understanding this, you can know MRI is generally good to analyze soft tissues, ligaments, cartilage, meniscus, spinal cord injuries, nerve compressions. Nerves get illuminated, means the imagery is good, not illuminated, the nerve imagery is good. Brain, when you talk about MRI of brain, you can see the different parts of the brain, the frontal lobe, the occipital lobe. You can see all the organs, all the parts of the brain separately. You can see the parenchyma, you can see the inside amygdala, everything you can see on an MRI of a brain. Why? Because it creates a magnetic image of the, to understand it easily, it's creating a magnetic image of the tissues, and magnetic image that is generated is dependent on the water content of that tissue, and water content of that tissue is different in different parts of the brain also. In fact, for any soft tissue, like a lot of people talk about joint spaces. So if let us say you twist your ankle, or there is some injury that you're having pain with in joint spaces, the doctor would generally order an X-ray. If there is some doubt in bony parts, the doctor will go ahead, maybe order a CT scan. But generally, if the X-ray appears completely normal and still you are having pain, the doctor would generally order an MRI. Why? Because the bones are normal, known by an X-ray. Now, when the doctor orders for you for an MRI, he's looking at the soft tissues around it, the cartilage, the ligaments, the meniscal, or any other soft tissue around that area which may be injured, which may be causing the pain, and hence that is the same that is detected on an MRI. So when you have a sprain in an ankle or ankle twist, normally your bones are perfectly fine, but there may be a ligament injury, there may be a tear in the tissue, soft tissue, or a tendon tear, which is easily detected on an MRI, and hence MRI is good for soft tissues of the body, means which are not hard. The reason is, as I already explained, the water content is different. So X-rays, CT scans and MRI, there are three completely different modalities. X-ray and CT scan can be compared. MRI is absolutely different. And then the fourth line of investigation is ultrasound. Ultrasound is again different from all these three. Why? Because in an ultrasound, what happens is there is ultrasonic wave. So what happens is an ultrasonic wave goes and comes back, reflects back. So ultrasound goes and reflects back. This reflection capability is different for different organs. So if, like, let us say a doctor is examining the abdomen or your stomach area or near that, so your liver, stomach, every organ will give a different reflection back, and based on that the doctor can analyze, this is liver, okay, this is stomach, this is the gallbladder, because the reflection is different and it appears as a different shadow. So what happens is the reflection from whole gallbladder will be different from liver, and the shadow of the gallbladder will appear on an ultrasound because that shadow appears exactly with that same reflection, and reflection from liver comes different imagery. So you can differentiate that, and if in fact if it's there's a stone inside that gallbladder, that again gives a different reflection. So you have a pouch in which you have a constant reflection, and suddenly a doctor notices that he's getting some hard reflection back from the inside of that pouch. That means there is a stone, and he can then outline how big is that stone by seeing the corners of the reflection. So that's how an ultrasound is done, how an ultrasound is different. Ultrasound can also be used and is generally used for in cases of pregnancy, to detect the uterus, detect the baby. In cases of kidney stones, ureteric stones and urinary bladder stones, ultrasound is generally the principal or the investigation of choice for these. The reason is simple, because it's a simple, harmless, you can get an ultrasound done 10 times a day also, and there's no harm, there's no difficulty in that, because it's just ultrasound beats coming back from the surface. Ultrasound is also done 2D echo, what you do, what the heart echo, what we call 2D echo, 3D echo. These all are ultrasound based solutions where an ultrasonic wave is thrown and then the reflection is received back, and that reflection is then analyzed further in terms of the shadows that are appearing on the screen live for the doctor. Especially so, ultrasound is good for pregnancy. The reason is, in pregnancy a woman cannot undergo an X-ray scan. X-rays and CT scans are contraindicated in pregnancy because X-rays can cause DNA damage for a baby, and hence not indicated for pregnant women, or in the private spaces or in the genital area. The X-rays are never recommended because X-rays are harmful, it's radiation. So ultrasound is good for those areas. Then obviously ultrasound is also good in terms of basically people who are not compliant to the big machines of MRI or CT scan. Ultrasound can be used as an investigation of choice in those cases also. So this is what we're talking about, and especially the point which I forgot to mention about MRI. If a person is having metal inside the body, if it's a pacemaker or if it's a rod, a orthopedic rod which is in metal inside the body, and MRI is contraindicated, MRI is not recommended. The reason is the MRI will cause, because it's a magnetic field, and metal, if you insert into a magnetic field, it will cause a very big problem, because it may create a tear out of the body. It will just eject out from the body because it's a magnetic field, and as soon as metal goes inside it, it gets pulled to that MRI machine and it will come out of the body. So it has happened. So people who enter an MRI machine and are having a metal rod or pacemakers, the pacemaker comes ejects out from the body. It's so high magnetic field that it tries to come out, and it can be fatal. So hence this is a contraindication, and you must know whenever you or your loved ones are going for an MRI that you don't have a metal inside your body. So I hope, friends, you are now able to understand. Though I said 5 minutes, I took 15 minutes of yours, but I'm sure you now understand why an X-ray is used, why a CT scan is used, why an MRI is used, or why a doctor advises you to go for an ultrasound. So if you did enjoy this video, please do like, share and subscribe, and don't forget to watch my next video. Thank you.